Thank you. So I think I have some 15 minutes to explain what Andaman is, and I'd like to put that in of course, the context of African countries, and say that I am convinced that there is a way to skip one step if you want. It's well known that in Africa, you went from no phones to mobile communications directly without having all the landline infrastructure that we have in Europe and the US, for example. So you really skipped that step. And for the banking, it's also very well known that you already have a lot of mobile banking, while we don't even have that sometimes in Europe or the US. So there, again, you skipped one step and you went directly to mobile banking. And I am convinced now that this could also be done for the healthcare sector, go directly to mobile health. Like others are trying to get there slowly, but since Africa has a lot of mobile phones and probably lacking some infrastructure in hospitals, clinics, and so on, then probably there's also a possibility to skip one step and to go directly to mobile health. So the opportunities there are numerous, of course. First, remote care. So addressing the challenges of infrastructure, the lack of doctors, and sometimes inequalities. The rest of the world is going that road clearly, and COVID is helping, pushing, or making it more urgent than we thought, right? So there's all kinds of now video consultations, remote monitoring of patients, and so on. And Andaman is a perfect complement to those tools. That's maybe more for the future, but partially automated care is also coming up by having some kind of automation for doing the easy things, right? So doctors don't have to do everything there, but that's a bit more for the future, I would say. And there's also the whole field of clinical research. So most of the research today is done in countries like European countries, American countries, while there are very specific needs for African communities for either existing drugs that need to be tested in those communities, but also for diseases that are specific to these areas, right? So clinical research is also something that should be developed in many African countries. Of course, all of that, I personally believe through my personal history, personal story, is that patient empowerment is the key. So I think that really individuals, patients really need to have full access to their health information and be able to share that with their doctors when they see different doctors. Having access to that data is also clearly a reduction of costs, and I have some proofs and some examples that I can share later if you want. Also, the patients is also making more choices than before. It's choosing their own doctors and so on. And then personalized medicine and on those new trends are becoming important. So I'm not going to spend too much time on this. I've reused this slide from another presentation, but I think you all know pretty well the challenges that are present in some or all countries. Let me maybe quickly say that Andaman is a small company. Started a few years ago, based in Belgium, and we have one investor from Rwanda in our investors, and we also have representatives in the US. So we're trying to develop the company around those axes. And what we try to do is also social project, meaning that we are offering to patients a free application. So today, if you have a smartphone, you can go to the App Store on Apple, or go to the Android store, the Google Play, and search for Andaman 7, and then you will get an access to the application completely free. And all of the data will be stored on your smartphone, and only on your smartphone, which is very important for us. We are not sharing any data, and we don't have access to the data of our patients. So you can already play with the application and see if it's good for you. So that's the social project. It's free for all patients. The application is available in 20 languages. But also what we're trying to do, of course, is try to get revenue to make the project sustainable. And who is paying? Usually it's clinics, hospitals, or the research industry that is paying us to provide an easy way to have access to patients and to be in interaction with patients. So we don't sell data, we don't sell health data, and we don't have access to the data, as I said earlier. All of this started a few years ago when I personally was diagnosed with a cancer, leukemia, and I've been put on a very efficient drug called Gleevec. And my son, Pierre, that you see on the picture there, was also diagnosed with a cancer just 3 months after me. He lost his leg to the cancer, as you can see. He also went through a lot of treatments, chemotherapy, radiation therapy, bone marrow transplants. So it was really two very different experiences in the same family. Mine was extremely easy, thanks to the existence of that drug. And for my son, it was a very hard, very difficult journey that lasted at least 2 years. And then the outcomes of that is very different too. He's working with a prosthesis, so he has this serious handicap, while I have almost no side effects. So these two experiences showed me very clearly that it's very important to contribute to research, to find new drugs. So targeted treatments are very important. We also realized as a family that we did not have an easy access to our health data, and doctors were constantly asking us questions about my son's health, what drugs he's taking, the allergies, previous conditions, and it's very hard to have all of that with you. So I built Andaman 7 to solve the problems that I had with these experiences. And then on the left side of the slide, and that's the social project. On the right side, it's the revenue side, if you want. So we can help either care players by helping them with continuity of care, so remote patients monitoring, telemedicine, and all of this. And also research, so medical research, so finding new drugs. So there we can help with what is called now distributed clinical trials or real world data collections, patient reported outcomes, and those types of needs for research. Andaman is based on a mobile application, but there's a lot going on in addition to that. The mobile application is just a visible part of the iceberg. So if you install it, you will see that you can enter any of your data. Hopefully you can connect to your hospital, but that depends on the country, and get your data back from the hospital. And then you can share your data directly. Even with the free application, you can share your data with your spouse, your parents, friends, or anybody you trust, right? So that is also completely free, and it's an exchange platform between two individuals. Of course, it uses internet, but there is nothing that is stored on the internet. So that's what it looks like on the left side. There are a few sections for, as you can see, allergies, drugs, vitals, and so on. It looks very simple, and don't be misled by this. It took a lot of time to make it simple, right? It's very hard to, yeah. So it takes a lot of time to make things simple, especially for patients, because it's about health information, which is usually quite complex. I will skip this. I will skip this too. These are a few examples of questionnaires that you can send to patient if you are a hospital, or if you are a pharma company or medical research company. You can send questionnaires, electronic questionnaires, to patients directly in the mobile application. So that's a very good way to exchange data between patients and other players. Of course, we have notifications, and there's also a very strict way to control who you are sharing your data with. As a patient, you decide if you share your data, and if you want to stop sharing data, then you can just, as you can see on the right side, stop sharing your data, and automatically the sharing is stopped. So how are we probably a bit different from most of the solutions out there is that we build a solution so that it can run in complete autonomy. So if you don't have internet access, you can still use the application, and everything is stored locally on your phone. Of course, there are backups, right? When you have an internet connection, then you can do the backups and so on. It's in your control, but the data is also stored mainly stored on your smartphone. Then when you have an internet connection, then you can exchange data with the ones that I was mentioning earlier, like your spouse, your friends, and your doctors, and so on. So that's a very important element. While most solutions are based on web solutions or that require internet, here internet is only used when it's available, and we can still use the application when there is no internet. It's more than a small application for patients. It's also a solution for others that would like to use it, individuals mostly. And what we try to do is to connect to existing systems like Lori's Backpack EMR solution for healthcare professionals. There we try to set up a connection with that solution and then allow the patients to get their data, enter information in the mobile phone via Andaman 7, and then send that data back to Backpack EMR, which is a solution for healthcare providers. So yeah, the benefits, maybe that's a bit long to read, but we believe that by having patients control their health data and be able to enter data, it will significantly speed up the quality of care and the availability of healthcare in all regions of the world. It's also an objective of many governments to improve the access to data. You know, in Europe, we have the GDPR, Global Data Protection Regulation, which is putting citizens and patients at the center again, and saying to all the companies, hospitals, and others that the data is really the property of patients. So you should give that data back to patients. And in the US, there are similar initiatives like HIPAA and Meaningful Use 3. So there is really a change of trends by putting the patients and the citizen back in control, which I believe is very important and will really facilitate and improve the care. Yes, that's a small illustration to show that the patient at the center can collect his data. Either they enter data themselves as patients. Of course, if you have a headache, you are the only one to know about it, right? So you are the only one to be able to enter that. But gradually also we connect to hospitals. So in the US, we are connecting to more than 10,000 hospitals because there is a uniform standard there. In Europe, it's much more difficult. In Africa, it's also much more difficult because there are no standards and no well-organized infrastructure yet. So we are waiting for that to improve. But in the meantime, you can collect your data yourself. You can connect to wearable devices like glucometers, blood pressure monitors, smartwatches, and so on. And then hopefully, gradually, you can connect to hospitals, labs, and get the copy of your data back on your smartphone and be the center of the aggregation of all these data sources. So what could be the future? What is the dream that we see and that we would like to share is that it would be great if each citizen or each patient has their mobile phone and a mobile app similar to Andaman 7 or Andaman 7 with all their health data locally stored privately on the smartphone. And then having access to that will allow them to exchange data in both directions with other players like doctors, nurses, hospitals, and so on. So that will probably enable better remote care, which is important in all parts of the world, right? Especially during pandemics like COVID, but also for other cases. Voilà, that's my quick presentation in 15 minutes, and don't hesitate to download it and contact us if you want to learn more about it and or make suggestions. I'm very open to.
Thank you, Lori. Hi, everyone. Ryan Rami here. I'm the founder and CEO of TeleVue, and we're going to talk about the technology that we're offering. As the name suggests, TeleVue, viewing from afar, and it's like you're always there. And our focus is really on providing a different kind of virtual care and telemedicine using AI, artificial intelligence, and AR, augmented reality. So the form factor that we use, we're going to talk about it a little bit, and I'll show it to you in a second. But how do we kind of get here to begin with? So access to care is an issue, and not just in Africa or even in Canada. If you look at the northern parts of the country, there's access to care limitations. So how do we provide a tool for the clinical folks to make faster clinical decisions? So if you don't have access to primary care or acute care, it's going to take time before you're transferred to a center with that expertise, and this time could be costly from an outcome perspective. So that was the intention of making this tool, to provide a faster clinical decision-making tool and improving outcomes as a result of that. But as we deployed this kind of technology, we realized there's other benefits such as cost reduction, improved efficiencies, and certainly patient satisfaction. Imagine if you were to receive care on the spot as opposed to waiting to be transferred to another center and then getting another appointment and so forth and so on. And along the way with our technology, there comes other technologies that we need to integrate into to make the solution more holistic and more inclusive, if you will. So that's kind of the overall picture, and just wanted to show you that before we start. Now, what we use are smart glasses, as I said, and smart glasses, if you're not familiar with them, think of them as a regular sort of type of glass that you might have, a little bit different looking in some cases, but they all have a little camera that is close to your dominant eye, or the eye that you're wearing the glasses. Here's another camera, here's another camera, and here's another camera. Essentially, what your eyes are looking at with the smart glasses is what the camera and the smart glasses is going to pick up. So that's a very important feature, because it's going to be a point of vision sort of videography, if you will. And that image can be transmitted to the other side, and the person on the other side can remotely view it. Now, the heads-up display on the smart glasses, now this is this model, but each model has this different heads-up display. That's how you know what information you're sending. It also acts as a monitor for you to look at information. So if the remote expert is sharing information with you, you're going to see that on the monitor. So here's how it's going to work. So as an example of a paramedic on board an ambulance transferring a patient, they have their smart glasses on. What they're looking at is basically what they're operating on, or the procedure. And that's what's being picked up by the smart glasses. That image is going to be showing on this heads-up display of the smart glass, so you know what you're transmitting. And it's going to go through a secure cloud that we have, which is ISO certified and HIPAA compliant and GDPR compliant based on European regulations. And the other person on the other side, which is on any device, could be on a computer, phone, or a tablet, and they could be anywhere in the world. So it doesn't necessarily have to be local. It's through the cloud, and everybody has access to the platform as long as they're authorized on that platform. So this is a pretty straightforward sort of communication tool. We have a web platform that the remote expert logs in to access the glasses. And the glasses comes with a pre-installed app that allows you to initiate the communication. Once the communication is initiated, both parties are in audio and video communication through the smart glasses, because the smart glasses have a microphone and a speaker built in, so you don't need a phone. And they connect through Wi-Fi or cellular, and we're going to talk a little bit about that as well. Now, I showed you an example of ambulance transportation, but this could be used in surgical settings, in home care, long-term care, any type of clinic, remote or otherwise, inpatient, outpatient, emergency rooms. Think of it this way, that you as the frontline clinician need some expert advice. You put the glasses on and get over-the-shoulder guidance from a remote expert, or the other way around. So you have an expert putting the glasses on and providing a new sort of learning method for you to look at a new technique or a new procedure and remotely watch and learn from it. Now, we talked about additional technology. So some of the other things I want to show you is that in in a procedure room or any type of clinic, you, in addition to smart glasses, which provides a point of vision feed, you have other information such as vital sign monitor, imaging monitors, X-ray, you name it, any of those monitors. There's also the room itself that sometimes you need to be aware of. So we can install cameras and bring the feed back into TeleVue, so you have a view of the bird's eye view of the room. We can bring all the screens that are available in the procedure back to TeleVue. And of course, the glass feed is also available. So when you're looking at it from afar, you can see different feeds. This is the feed from the smart glasses. This could be a feed from the ultrasound machine, or it could be a feed from the vital sign machine. So you get the idea. You got multiple feeds that you can pick and choose which one you want to focus on to look at. It's also important to have flexible connectivity options. So this example shows you one-to-one communication. So you have the, let's say, the person wearing the smart glasses in communication with the remote expert. So that's one-to-one, and they can exchange information, audio, video, and a whole lot more. I'll talk about the augmented reality in a second. You can have more than one person on the call. So let's say the first expert doesn't have all the answers and they want to bring in a second person for a second opinion. So now you could have multiple people communicating with the glasses. You can have two glasses communicating with one expert. This is also a good example of it would be in the operating room, for example. You have the surgeon wearing one glass, the scrub nurse wearing another glass, and they can both communicate with the remote expert. And last but not least, you can have the procedure broadcasted. So somebody's performing a procedure, they're broadcasting it, and a larger audience out there can watch and learn from it. So another thing you could do with the glasses is you could actually follow procedural instructions offline, if you will. So you don't necessarily always have to be connected to a remote expert. You can actually put procedure instructions on the glasses, checklists, or workflows, and you can follow the instructions on the glasses using the slideshow, if you will. It's all through audio commands. You answer the questions on the screen, you follow the instructions on the screen, takes you to the next step, and so forth and so on until you complete the procedure. At the end of the procedure, everything is logged, so you know somebody finished the checklist or not. As you can imagine, there are various use cases for this technology. It could be acute care, ambulance transportation, you saw senior care, surgical procedures, wound care, any type of medical education, and of course, biomedical services as well. So very flexible, very versatile, and most importantly, low-cost technology that doesn't take much space either. So I'm going to skip this because I did the flow view. But let me talk to you quickly about another technology. So what you saw so far with the glasses was in the primary care and acute care setting. So this was more so a peer-to-peer communication tool. The nurse communicating with the doctor communicating with another doctor. But at one point you send the patient home, and when they're at home, they need to be monitored as well for some cases. And this is where BioView comes in. So BioView is a remote patient monitoring platform. It's also cloud-based, and I'm going to talk to you a little bit about it. So we have this single device, and I'm going to show it to you as well. It's a handheld device, palm size, and this device does four things. It could measure SpO2 with a single finger. It could measure temperature, touchless. It could do single lead ECG with 3-touch, and then it has a special blood pressure cuff that you can do blood pressure with it as well. So all these 4 parameters are available through the cloud, and you could triage the patient using our algorithm, which is utilizing Muse2 algorithm for identifying patients' risk score, if you will. Whether you're monitoring chronic diseases, episodic monitoring, let's say a patient has a bout of arrhythmia, pre and post-discharge monitoring, any type of clinical research that you need to collect data. And you can also send patient education material and also surveys to the patient to keep in touch with the patient and know how they're feeling when they're away, instead of visiting them or making home calls or calls to them. So this is the complete platform, if you will. So you got the device itself, and it comes with a nicely laid out app. The app is very simple to use. It only has one screen. and that's the only screen that the patient has to learn about. Everything is color-coded. So changing the sensor would change the color, not the screen. And you just basically get used to that one screen and get all your measurements through that one screen. You can also make video calls through the same app. So if there's a need to get in touch with your care provider, you could use the same app to make that call and exchange information. We also have a scale that was introduced recently, and this also talks to the same platform. So there's 5 vital signs that you can basically measure and communicate. On the other end, there's a dashboard for the clinical user that they can log in and they can actually visualize your parameters on the cloud. And this dashboard is available to the patient as well. So you as a patient have access to this page only, and then you can share it with your family, you can share it with your caregiver, you can share it with your physician. But at a hospital level or at a clinic level, there's a broader dashboard that allows you to add or remove patients to the clinic, modify care plans, communicate with the patient, text message them, call them, email them. So it's all done through this platform. So all there's to say is the TeleVue and BioView platform provides you spectrum and ecosystem of technologies that allows you to follow and visit the patient both on the acute and primary care setup and get expert advice, and also when the patient leaves the clinic and leaves the healthcare setting, to be able to follow up the patient as they're in the comfort of their home. I'm going to stop here, and if you have any questions, I'm happy to answer them after the call.
And anyway, we've been doing surgical work in mission trips for, gosh, I was the previous executive director of Mending Kids, and we were sending out about 30 teams a year. We were present in 60 different countries, basically in every specialty, working in surgical care. And back in the day, we would, send out a surgical team and put them into the field and help out any way that we could. And then it really was a matter of really addressing the local challenges in training. And so we sort of moved everything over to really a more training aspect. But as you all are very well aware, mission trips are great, but they're very short-lived. You're there for a week, you're maybe there for 10 days. And there's so much opportunity and so much room for friendship and working together in the environment, whether you're on a surgical mission or a medical mission or whatever the case may be, to really learn from each other. And so I know from our end, when our mission teams would come back, they would get really disappointed that they couldn't only go for a week out of the year. Sometimes 2 weeks if it was in Africa or somewhere else, but those trips are very, they're very intense. And we kept saying, that'd be really great if there was a way that we could augment these mission trips and continue a relationship past that, week when we were on a mission. And boy, wouldn't that be cool if there was something out there. And so back in 2015, when we were with Mending Kids, we had a early entree to Google Glass, which Ryan just showed you in his demo. It was the very first pair of glasses you saw with that were the streamlined gray ones. And the Google Glass was an interesting concept in 2015, and the idea that, wow, maybe we could use these in a surgical setting. Google hadn't been doing it then. So really interesting opportunities there. And we said, boy, this would really be cool if we could utilize this to keep people training year round. And so we did a test, and we sent a test of the Google Glass to Mozambique, to a surgeon who was there working in plastic and reconstructive surgery. He was working out of Maputo, and he had a really challenging time passing his COSAXAs. He took the test twice. He did not pass, and he had one more chance to take them. And so our surgeon here, who is a plastic and reconstructive surgeon out of Cedars, sort of took him under his wing and said, I'm going to work with you on the practice for the COSAXAs, and we're going to do it through these smart glasses. with the use of a technology and the software and the hardware. And so for 18 months, they worked together on various cases, answering questions and going through some of the items from the board exams. And after 18 months of working together, not only on the glasses, not only did he pass his COSEXAs, but he was the second highest score in all of Africa when he took them. And we realized at that point, we were really onto something. It was really important that it was going to be something that we really thought, wow, there is something to be said about this. And more training is more training for anybody, no matter where you are. You know, more is always more is always better. And so it was really exciting for us to kind of look at this and go, this technology might actually mean something. So several of us started an organization called Ohana One, which is a nonprofit that specializes in utilizing technology, basically to get technology out to more remote and rural areas so that people can be connected on a more regular daily basis in access and training. And really that's our main mission, is surgical equity and surgical access, and having boots on the ground be able to utilize the tech to say, I got to call somebody right now. I have a case that I don't understand, or I need help with something, or I'm able to give help to one of my colleagues, and how we're all sort of, you know, interconnected. So a few years ago, when we started Ohana One, we switched over from Google Glass to Vuzix, and Ryan had showed you the glasses on the screen. I've got two of them that I'm going to show you today, and Ryan did a great job, thank you, Ryan, of giving the mechanics of the actual glasses themselves, but I can show you as I'm putting them on. So these are the M400s. These are glasses. They kind of have a lensless frame. And since I don't wear glasses, I can use these. But for those of you that wear loops or glasses, it also comes instead with a headband. This is a battery that comes off of here and can slide onto the headband. And this is the camera piece that can slide off of here and go on the headband. I'm left eye dominant, but if I were right eye dominant, I could switch these things around very easily. And there's also a power cord that wears in the back that connects the battery to the camera. I don't have that on right now, but it comes with that. And this is in a case that's about the size of a men's shaving kit. And altogether it weighs about 2 pounds. Through Vuzix, we have a reduced cost for the glasses at $1,500 a pair US, but you can apply for a grant through Ohana One, and I'll put my information in the chat for that in particular. And then we work with you on the software, and we can help to partner up with you with TeleVue as well, and make sure that you're connected into TeleVue. So these particular glasses are a hands-free way. So if you're in the operative environment, you're in a clinic environment, your hands are on the patient, they're not on the glasses. They're worked with voice remote, and they're, like Ryan said, there's a camera that's externally seen. So if I'm looking down right now and I'm operating, I'm going to adjust this external camera so that it can see what I'm seeing. And through software, you all would be able to see right now my pad of paper that's down below, but if I was operating. And when I look up, you can see that it is not impeding my point of view. There's also a really nice range of motion here. Again, this slides back, and this actually also moves this way and this way. So you can really get the adjustment that you need to be able to see. This is also, there's a little onboard camera on the inside that Ryan showed you. And so at the same time as I have these on and I'm showing you what I'm doing, I can watch in the little window back, and you can show me what you're doing and what you're teaching through the software. So it's pretty cool, super robust. The battery lasts a couple of hours and can come with another backup battery. And there's also, it works with voice commands. There's 3 little buttons on here that you can also power with, and then there's a touchpad right here and a companion app that you can use. The other ones that he showed you are more for a clinical environment, something that you don't need so much detail, and only if you're right eye dominant, is the Blade. And this is the Vuzix Blade. So Again, my hands are free. I'm able to show you what I'm seeing. So again, if I'm in a clinical environment or working with a patient in any way, through these particular glasses, I can help you to see what I'm seeing. These are about $1,299, so let's say $1,300 US. And again, if you're not in a surgical environment and you don't need that much detail, they're pretty easy. They can also be refilled with your prescription, which is about $150 US to do. And again, it's only if your right eye dominant does not allow for the switching, but they're super comfortable, really, really easy. And they come in a little kit as well, with a little same kind of a backup battery. It also comes with a collar neck battery that you can wear pretty comfortably in any kind of environment. So the glasses are really great because, you know, what they're really allowing, again, is kind of the see what I see. And it allows for that continuity of care. And I think, Vincent, you really talked about that well. And what a story about you and your son. That's a lot for one family to go through. But, you know, if some people are going through those in a country that is limited more on their resources, what we're trying to accomplish is connectivity between colleagues and saying, okay, I might not have what I need here, but I can reach out to someone that does. And I can maybe invite them to get onto the glasses through the TeleVue software and help do a diagnosis or help with a surgical aspect or something. So as Ryan was sort of saying, it's, you know, an expert that you can be where you need them to be at the time when you need them to be there. Not when you go to a conference once a year and say, gosh, I had this patient 6 months ago. I really wish I would have talked to you then. You could have been really helpful for me, or this patient had to wait until I get here. This is more in the moment, so that patient care and what we're doing, we can really be connecting and be somewhere, even though that we're not physically there. And I think that that's what the beauty is of the technology. So we're pretty excited about that. All of this, I think there was a question, all of this information from the Vuzix glasses through the software is all uploaded into a HIPAA compliant backend. So you're no longer sharing your pictures and your video and stuff maybe on your phones or whatever. It's going into a HIPAA compliant backend that's very safe and secure. These sessions that you're having in a training situation with the software can be recorded if you want. Or not recorded, and you can use those for video library purposes down the road. So really nice to be able to have. It does require a Wi-Fi connection, typically somewhere between a 3G and a 4G. Your personal hotspots do tend to work. Mobile hotspots also work, and we can help you run speed tests prior to make sure that you have the bandwidth. And again, through a grant through Ohana One, we also support a repeater or a hotspot if you need it. We are really intent on making sure that there are no barriers in the use of the glasses or anything else. You know, just again, thinking about the applications for the things that we talked about in remote clinics. So let's say that you're operating a remote clinic, or you have colleagues that they are going to triage a patient prior to doing a transport to a larger center. You can grab the glasses off the wall, you can put them on, and the two of you can have a conversation about what to do with that patient. Like Ryan said, in an ambulance environment, basically anywhere where you always say to yourself, boy, I really wish there was someone here right now that could just maybe give me a second opinion, be there, you know, as a confidence boost. You know, kind of partner with me on this and be here when they're not present. So we're really excited. The technology is amazing. Right now we are I think we're in 45 different countries. We've got 140 surgeons on our platform, and super excited about what we're doing here. They are, each of the headsets requires a login, a specific login. So for the person asking the question regarding the security device feature, once you do put the glasses on, or even go into the software, it will ask you for your login. Once you've logged in once, though, you can log in pretty easily after that every time, throwing those on. If you were going to have maybe 3 or 4 surgeons or practitioners sharing the same pair of glasses, we would provide you with separate logins so that you would be able to then track which surgeon was on that login and the amount of training and the amount of support that they were doing. So we're very excited about the technology, the way that it's used. And yeah, so we're based here in California. Again, I'll put my information in the chat. Happy to get on to a demo with you, any members of your team. And we do provide grants as they're available for this kind of technology. So thank you, Lori, again for having me today. I really appreciate it.